All right, look who's with us. Lots of questions. Does new data about the AstraZeneca vaccine boost confidence that the U.S. may authorize a fourth option to prevent COVID? Here to answer that and so much more, Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. We so appreciate it. I know we talked about AstraZeneca the other day. Things have changed now since the last time we talked about it. It's been in the news for all the wrong reasons recently, AstraZeneca has. And they now say the vaccine shows 76% efficacy at preventing illness. Initially, they said it was 79%, right? That was the initial thing that they said. 100% efficacy against severe disease or hospitalization. So you tell us, in your opinion, as an expert, is that what matters the most? Or do you still have questions about this vaccine?
Maria, I'm happy that the company turned around the results and gave us a more, what I think is up-to-date results. My guess is they left out about the last month or so as part of their data log. So 79% to 76%, that's a small difference, but it's what we want is accuracy. And the 100% against severe hospitalizations, ICU admissions, deaths, that's great. I do think this is an effective vaccine. I do think this is a safe vaccine. Now we have to wait for the FDA and the CDC to agree on that as well.
Yeah, and to that end, Dr. Ellerin, AstraZeneca says it does plan to submit that application to the FDA next month, requesting the emergency use authorization. Do we need a fourth vaccine? Can we vaccinate everyone with the manufacturers we already have? Do we really need this approval?
Erica, we really do, and I'm going to tell you why. It may be that 3 vaccines are enough to vaccinate the United States, but the United States has to be part of a global vaccination campaign, and they are as far as COVAX. So we also have to distribute our vaccines to around the world, because remember, as you know, what happens in one part of the world can affect all of us.
But we're approving that here, so how does that impact us?
Well, the question is how many of us will receive the AstraZeneca vaccine? That remains to be seen. That will be part of the distribution campaign.
Governor Baker announced good news today about the state's vaccine supply, an extra 40,000 doses of Johnson & Johnson. Nobody expected that. So what's your advice to public health officials about distributing these vaccines before our supply becomes available to everyone in 3 weeks from now?
So, of course, this is good news, right? And remember, Johnson & Johnson vaccine, it's only a single dose and only requires refrigeration. So we've already heard that Governor Baker and his team wants to give about 25,000 doses to housebound people who are so infirm that they can't leave their homes. I think that's wonderful. Okay. The other part is I think this should be part of our equity campaign. So ideally, we would try to get this vaccine to the people that can't come to the larger mass clinics, and by doing so, getting some of the communities of color that have disproportionately less vaccines than others.
Yeah, maybe mobile vaccination. And finally, we wanted to ask you about this international story. It got our attention. India has now identified a new double mutant variant of the virus. So first, what does that mean? And could it be more dangerous than these other variants we've heard about?
Right. So the first thing I want to say is double mutant is not really a scientific term. If you want to look at the 117, the 351, the P1, those all have multiple mutants, and more than 2, by the way. So I think the key here is that there are variants in India. India's having about 55,000 cases a day. They look like they're having another spike. The key is that we have to decrease transmission. So just like what I would say about in the United States, we have to double down on our infection prevention measures, and we have to vaccinate as much as possible, because it really is still a race between variants and vaccines.
Do you think that's a race we can win?
I do think that the virus has a competitive advantage, but I do believe that we're going to be able to make COVID-19 a less severe disease. So ultimately, I do think we're going to win. That doesn't mean I think we're going to eradicate COVID-19 completely. I
know I put you on the spot with that one, but I liked your answer. So good. That was good. I'm sorry to do that to you, Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health. Be well. Great to see you, and thanks as always for your time.
Thanks, Dr. Ellerin.